Hi, my name is Jason Spangler, the CEO of the Innovation and Value Initiative. During the 5th Annual IVI Method Summit, we explored patient-centered health technology assessment, or HTA, and charted its future course through discussions, methodologies, and networking with thought leaders. We aim to offer actionable steps for stakeholders to implement patient-centered HTA effectively. The closing discussion, titled, "What Comes Next for IVI and Patient-Centered HTA?" It featured as moderator Elisa Halpern-Paul from Venable and Rick Chapman from the Innovation and Value Initiative.
So one of the things that I took away from this is, and it really came through in all the rich discussions, and they were so rich it made it hard to pull out a few threads because everything is so related and all of the panels really held together. Okay. So one, I think, is just the importance of these types of meetings. And we've heard that over and over again, that it's important to have this continual engagement of different stakeholders so we can all hear what are the pain points we all have, what's important to us, and what can we learn from each other. I always hear new things when I come to these meetings and I always learn something. One of the things I took away from the opening keynote was a point about moving from talking about issues to bringing them into action and putting them into practice. I also heard several tensions that were brought up over the course of the day that we really need to acknowledge to move forward. One of those was around the tension between, in the equity discussion, the tension between population level and individual decisions, and how we need to acknowledge that and really have honest discussions about where we're each coming from and what we're thinking about, so that we can really trust each other when we're having these discussions, that the reason we're saying things is because of the perspective we have, not because we're trying to ignore what other people are saying. New methods, such as real option value, we heard that they may need work, but I think we also heard it's important to just try them out. And that's something that I think Barry brought up is, let's start, let's try these, see what works, tinker around with it, and then, move it forward. It's one thing to talk about it or to talk about the theory behind things, but we really learn a lot when we put it into practice. I think another thing that kind of echoes that was something we heard from Simu around the need to move beyond old formulas and really think about new ideas and new ways to think about this. And I think that's one of the other tensions that's here is the old formulas that we're comfortable with and these new methods that we may feel like we're less comfortable with, but we need to acknowledge. Related to that is another tension that we really need to look at patients holistically and their health and things around them, and not just think about them as patients, but as people who have a lot of things beyond healthcare that we need to care about. And a lot of things that are qualitative, not just quantitative data, that we have to acknowledge that there's a tension between the qualitative and quantitative, and really think about mixed methods. And we've started at IVI to try to think about how can we bring mixed methods into our work more. There was a quote I came across recently. It's not from an anthropologist, but from a sociologist. And like Sneha, I was glad to hear anthropology mentioned because that was my undergraduate major. So, but this is William Bruce Cameron, and he says, "Not everything that can be counted counts, and not everything that counts can be counted." And I think whenever we do any kind of analysis or HTA, we need to keep that in mind, that we don't have all the answers, that those gaps are important and we need to acknowledge those limitations. I think we heard that there's a need for a change in culture and mindset. It's not just about new methods, but really about how we think about this. That's something that Anton and others have brought up. And so I think we need to ask at the outset, something that I'd written this down, but then Barry said it, so I was glad to hear that. Who's not at the table, but should be here? And how can we engage the people who are not at the table and make sure that they're going to be there so that we can involve them in an authentic way? And I think I'll just end with a quote from Barry: "Let's start and learn by doing." So I think that's one of the things that at IVI we really try to take to heart is we may not know everything about how to do this, but let's start and we'll learn along the way. So.
Those are great. I have a list of things that I wrote down, and I was checking lots of them on the list, Rick. That was a great summary. I'm going to add, I think, just two other things, and in the interest of time, wrap up and let people go enjoy this beautiful afternoon here in Washington. I was struck by the comment, and Barry lifted it up, which is we have right now two definitions, right? We have health technology assessment, and then we have patient-centered. And someday, soon, we should have one that's all inclusive. And I go back to last year where, and I think it was a Barry also, again, showing her great insight and wisdom, which is if we don't have equity, we don't have value. And so I'm going to posit today that in addition, and if we're not patient-centered, we don't have value. And so without equity and without being patient-centered, we don't have a value structure. And so I think that's our challenge. That's our call to action for the year ahead of us. And as part of that work, all the other things we talked about today, transparency, building trust, being inclusive, understanding diverse perspectives, bringing in anthropologists and sociologists. And I'm going to just lift up the social workers again, because they're amazing. And patients involving modelers and modelers involving patients. I think that was one of my big takeaways from this morning's kickoff conversation is it can't just be one direction. It has to be bi-directional. And I want to lift up what Sneha mentioned about patient advocacy groups and the importance of being inclusive and recognizing that not everybody has the same resources. And that's part of equity. Part of equity is ensuring that those who don't have can still have a seat at the table. Full stop. And so I think that was a great call to action. So thank you for that. I suspect people will be following up with you. Maybe we can create a scholarship program or some other mechanism, or we'll do a GoFundMe, something creative to get more of the patient groups at these important convenings. And my last is, I love that we now have a verb called that is relationshiping, which is so great. Because that captures it, right? So it's not just engagement and it's not just communicating, because you can communicate with anybody and you can engage anybody, but a relationship, right? That's long lasting, that's sticky, that's something where you have trust and it's mutual and it's bi-directional. So my last call to action is, in addition to all this great work, we have to make sure that it involves this long-term relationshiping in the important work that we do. Even though sometimes it's all about the numbers, it's about the people who are doing it and the people for whom we are ultimately doing it, that patient-centered focus of today. So with that, I want to give a few thanks, which is I want to thank Rick. I want to thank all of our panelists and speakers. I want to thank Jason. I want to thank the whole IVI team. So join me in thanking IVI team. Stand up. Let's see who you are. You're terrific. This would not have happened without all of the amazing IVIers. I also want to thank my colleague, Vince Oliver, who was the tech team, who you didn't get to see him, except for on occasion he poked his head out to remind us about the microphones. I want to thank Helen Marino, my assistant, Seasons Catering here at the firm, and Pfizer for their support. And I always like to also acknowledge, I'm from California, which is the nation's salad bowl. I want to also acknowledge and honor the people who work and got the food and the fruit and who made all of it possible for us to have that delicious lunch. So with that, unless we have anything else for the good of the order, thank you so much for joining us. Thank you everyone on Zoom. Thank you IVI. Thank you all for being here. And let's go put it into action and do some great work. Thank you.